Since the start of the Syrian crisis, the Zaatari refugee camp in Jordan has become home to thousands of women and adolescent girls who fled the violence in their homeland. Many of these refugees have come to depend on the services provided by people like Mama Munira, a nurse midwife providing desperately needed help to pregnant women and girls who are trying to rebuild their lives. Midwives like Munira Shaban are essential in crisis situations like this. UNFPA, the United Nations Population Fund, estimates that 1 in 5 women is expected to become pregnant during such an event. Midwives can sometimes be the only ones with the skills to help prevent these women or their children from dying during childbirth, and Munira will do all that she can to help them.
They need me for deliveries, for pregnant women, for children, for family planning and the methods. And I felt that I know all this knowledge. Why not to get?
And this knowledge and set of life-saving services midwives provide is desperately needed throughout the world, according to UNFPA and its partners, who have just released a report detailing the state of the world's midwifery. The report, titled The State of the World's Midwifery 2014, A Universal Pathway, looks at the 73 African, Asian, and Latin American countries that suffer 96% of the world's maternal deaths. These countries, despite facing the lion's share of maternal mortality, have only 42% of the world's midwives, nurses, and doctors. Dr. Babatunde Oshotemehin, the executive director of UNFPA, says that in a humanitarian crisis, such as is facing the Syrian refugees in Jordan, a midwife literally makes the difference between life and death to thousands of women and newborns.
There are no doctors. So a midwife in that circumstance is God sent because she can do everything to save the lives of mother, baby, and also the children around who might require attention.
Midwives like Shaban can provide nearly 9/10 of the essential care women and newborns need. This is critically important in countries where quality hospital-based maternal care is limited, or where economic, geographic, or social barriers block a woman's access to it, something Oshotemehin is well aware of.
And the midwife in those circumstances is perfect because it means that she can intervene, first looking after them, before they give birth, and then ensuring that she supervises delivery and then looks after them after they deliver, so they and their children are healthy.
For UNFPA, this is Omar Khazraoui.